USD248 Board of Education to order. Please join us in reciting the Pledge of Allegiance. Flags up here on the north wall. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ms. Murphy was not available to attend in person tonight, but we're thankful she is here via Zoom. Thank you. The second agenda item is additions to the agenda. Do we have any additions to the agenda?
Madam President, I would like to recommend a motion
Beth, could you say that again?
I would like to recommend a motion to the agenda to discuss and possibly amend the current return to school policy, specifically in regards to face coverings.
I have a motion from Ms. Murphy to add an addition to the agenda to discuss and possibly amend the current return to school policy, specifically in regards to face coverings. Do I have a second? Do I have a second? If we do not have a second to Ms. Murphy's recommendation, the motion fails and we will leave the agenda as is and move to the board agenda item number 3, approval of the agenda. I would entertain a motion to approve the agenda and consent items. So moved. Moved by Peggy.
Second.
Second by Roger. To approve the agenda and consent items, which include board agenda numbers 3 through 6. All in favor say aye.
Aye.
All opposed say nay. Approval of the board agenda and consent items carried. We will move to agenda item number 7, patrons' comments. Again, welcome to all our guests. If you would like to provide patrons' comments to the board, we would ask that you state your name before doing so for the board record. We do have an adopted policy that is a board policy addressing public participation during board meetings. And I have asked Mr. Goebel, our senior board member, to go over the rules and procedures for how we conduct patron comments per our board policy.
Typically, when we have a large group, public comment is limited to 3 minutes per person. A board member will be the timekeeper. And by policy, board members do not interrupt or interact unless they have a question of clarification. That way, whoever's presenting to us has the opportunity to speak their full opinion without interruption. If there's a group of individuals of a common call, they can ask one person to be their spokesperson if they desire to do so. And if that's the case, it represents several people, we'll give them additional time to talk. Like Lori said, I think we know just about everybody in here, but for the record, please state your name and the issue you wish to convey. And who'd like to begin?
Me. My name's Craig Taylor. Masks have been tried, they didn't work. New studies prove them detrimental in certain areas. Decreased oxygen level, increased carbon dioxide levels. The masks themselves harbor germs and viruses. Small fibers of the mask go into the lungs. COVID has a very low death rate for high school kids. Our kids will take their chances. Can we sign waivers? Sickness or death from the mask, and believe me, there's going to be testing now if something goes wrong when the kids are wearing their masks. There's going to be lawsuits. Change this, please. It's ridiculous. This is a red state. This agenda comes from the far left. It's socialistic, communistic, tyrannical, and totalitarian. Thank you.
Who'd like to speak next?
My name's Chris Pike. Most of you do all here know me. The reason I decided to come to the board meeting this evening has nothing to do with the masks. It has everything to do with the choices that you're trying to influence on my children. Every day they go to the teachers in this school, they come and see every one of you. I've personally been taught by some of you on the board, and the rules have changed so much over the last 20 years that it's getting ridiculous. You are a school board. You are not the health department. You are not the person that tells me how to raise my kid. You are here to educate. That's it. There is no reason for anybody in this room to influence my children on their health decisions but me. Thank you.
Sorry guys, I'm moving forward here so that everybody can hear me. I don't talk as loud as some of these folks.
You have a microphone if you'd like it.
That would actually be wonderful. Thank you. I'm Rachel Stevens. I'm actually going to speak on behalf of several individuals. I'm going to speak on behalf of Dave and Lavera Woods, on behalf of Jacob Lehman, and on behalf of Tom and Stacy Brooks. How about that? I've also prepared some statistics. School board members, Superintendent Bauer, parents, and community members. Before I begin, I would like to state that I'm here tonight to voice a dissenting view on a topic that's controversial and it's nuanced. I'm speaking tonight as a parent and a physician. I'm not representing the views of any other physician or medical institution in our county, including Girard Medical Center, my current employer, Ascension Via Christi, or Healogics, my soon-to-be employer. I would like to thank the school board and the superintendent for allowing the community to voice their opinions tonight and for your service to Girard. My name is Rachel Stevens. I'm a family physician. I've been employed by Girard Medical Center. I'm a parent of the Girard High School team, and I'm a Trojan, born and raised. I worked at Girard Medical Center for the last 12 years for our community's families. I recently had the pleasure of sitting in on Dr. Stebbins' presentation at the Frontenac School System, and my husband is the publisher of the Hometown Girard newspaper. I've not personally met Dr. Stebbins, but he has cared for many of my patients through the years with dedication and compassion. So I feel as though I do know him. I can certainly attest to the quality of his care. In 4 weeks, I'm going to be leaving Girard Medical Center to work alongside him in a new capacity, and I'm very much looking forward to that working relationship. Over the last 18 months, I've been singing the praises of our Girard and Pittsburgh hospitals. Our physicians and medical staff are second to none. The quality of care that they've provided during this pandemic is to be applauded. I agree with Dr. Stebbins and our county health officials on many aspects of our current situation. I agree that our vaccines are effective and dramatically reduce the risk of severe disease and death, that we have good treatment options, both inpatient and outpatient for this virus, that it's widespread and that it's extremely contagious, especially so with the latest variant. And also that our medical community is fatigued after the last 18 months of dealing with critically ill and their families. Caring for a person who is near death and comforting their family is something that few people can fully understand. It takes a physical and emotional toll that most will not experience in their life. As a family physician, I have dozens of these experiences that I can call to mind that allow me to empathize with Dr. Stebbins when he became emotional on Monday discussing the state of our medical providers at his hospital. I emphasize that I have dozens of experiences like this because Dr. Stebbins as an ER provider likely has hundreds if not thousands. As many of these concentrated in the last 18 months. I would like to thank him and all other physicians who are present today for their service to our community. Despite my sincere respect for Dr. Stebbins and our local health officials, I respectfully disagree on the matter of mandating mask wearing in our schools. My first training in the scientific process came from right here in this building, from Mr. Loeb, one of my daughter's favorite teachers today. Science is, in fact, a process that includes formulating a hypothesis, testing a question in mind, collecting data, and repeating the process. However, scientists are necessary to interpret the data collected. The problem with scientists is that they're human. They have their own history, culture, bias, and opinions. This means scientists at times disagree on the interpretation of the data and its meaning for society. This is one of those times. I've looked at the same data as Dr. Stebbins, our county health director, and other medical providers, and in fact the CDC, and I disagree with their advisement. This week I have been repeatedly and quite forcefully reminded that I'm in the minority. I'm comfortable with being in the minority. Booker T. Washington once said, "A lie does not become truth, wrong does not become right, and evil does not become good just because it's accepted by the majority." As of August 11th, 2021, there were 36.1 million cases of COVID-19 in the U.S. 50.7% of our population is now fully vaccinated, 71.3% of adults with at least one shot. There have been 4.3 million child COVID cases in the U.S. since the onset of the pandemic. That's according to the American Academy of Pediatrics. There have been 43,151 in the state of Kansas as of August 5th. Of these child COVID cases, only 0.1 to 1.9% resulted in hospitalization. In Kansas, as of August 5th, there were 206 total child COVID hospitalizations. That is from the beginning of the pandemic. Of all child COVID cases, 0 to 0.03% resulted in death. Since the beginning of the pandemic in the state of Kansas, 2 deaths as of August 5th. These statistics hold true for the Delta variant, which has proven more contagious, but not more dangerous, according to a statement by the American Academy of Pediatrics. By comparison, in 2017 and 2018, the influenza virus killed 643 children, according to the CDC. Dr. Stebbins listed 2 main reasons for his recommendations to local school boards: to keep kids safe and keep the community safe. When I look at the hospitalization and mortality rates of COVID-19 in children, my conclusion is that our children are safe. In contrast, since the onset of this pandemic, adolescent and young adult suicidality has dramatically increased. According to the CDC, in 2020, 12 to 17-year-old females had an increase in suicide attempts in the ER by 31%. That's a mean weekly ER visit of 408 weekly. In 2021, this has risen by 50.6% compared to 2019. That's a mean weekly visit of 855. In June of 2020, a report came out that 25% of 18 to 25-year-olds surveyed had experienced suicidal ideation in the past 30 days, directly related to the COVID-19 pandemic. I have seen these young adults in my office. I would venture to say Dr. Stebbins and other providers in this room have seen them in the emergency room. Why might suicidality be increasing in our kids? The CDC postulates that it's due to physical distancing, isolation, lack of connectedness, barriers to mental health treatment, increase in substance abuse, anxiety about family health and finances, and an increase in domestic and home violence. Our children are not immune to our stressors. As to Dr. Stebbins' second statement, to keep the community safe, according to the CDC, there have been only 7,101 fully vaccinated patients admitted to hospitals during the COVID-19 pandemic. That's 0.02%. There have been even fewer deaths, 1,507, or 0.004%. Breakthrough cases do occur. They're rare and they're mild. 3 extremely effective vaccines are now available. They're available free of charge, and they're available universally at every local pharmacy. They're available for all over the age of 12. These vaccines are not only effective, but severe side effects are extremely rare. My question for the school board is that with vaccines universally available and with their efficacy clearly presented on a national level, why are children being penalized for the decisions of individuals opting out of vaccination? I would argue personal responsibility lies with adults, not their children. It should also be noted that we do have treatment protocols for COVID-19 both in the inpatient and outpatient setting. These are both therapeutic and effective in prevention of severe disease. Outpatient monoclonal antibody infusions have essentially cut the risk of hospitalization and death in half for patients at risk for severe disease. My last argument would be that cloth masks are minimally effective in certain circumstances. According to the CDC fact page, cloth masks, quote, poorly performed compared to surgical or N95 masks, and should only be used as a last resort when surgical or N95 masks are not available. Their efficacy is dependent also on the following factors: types of fabric, layers of fabric, daily washing, snugly fitting the face, covering the nose and mouth, avoidance of touching and washing hands after, continuous use, and care taken in removal so as to not infect one with the mask in question. Ask yourself if your kindergartners, or teachers for that matter, follow these measures. The CDC closes with, quote, the general public should be educated about mask use because cloth masks may give a false sense of protection because of their limited protection against acquiring infection. I agree with everything the CDC says in this statement. My philosophy in medicine has long been to implement treatment protocols that improve a patient's quality and quantity of life. I reevaluate frequently, and if a treatment fails, I discontinue the treatment. It's easy when you're emotionally exhausted and physically fatigued, as we all are at this point in the pandemic, to argue we have to do something. Our medical providers, health departments, and policymakers are emotionally exhausted and physically fatigued. They're attempting to make the best out of a difficult situation. This mentality has led to some sincere but dramatic missteps in the last 18 months. It led to people wearing masks outside, to virtual schooling with dramatic reduction in educational metrics, indefinite lockdowns, resulting in economic losses, financial hardships, and innumerable consequences. It's our duty as scientists to look dispassionately at the data in front of us and make recommendations based on evidence, not on what-if scenarios and the fear of the unknown. It's our duty to resist the urge to act rashly and instead to dedicate ourselves to pursuing evidence that clearly outlines beneficial treatment and prevention strategies. There are risks and benefits to everything in life. Our actions now will affect our children in the future. My recommendation is to let our kids get back to being kids and give personal responsibility back to the adults. Allow parents to decide whether their children mask up. Thank you for your consideration.
Would somebody like to follow that eloquent speech?
Good evening. My name is Sarah Olnicki. My husband Bryce and I have been blessed with 3 healthy boys. Knox is 6 and in 1st grade, Finn is 4 and in his last year of pre-K, and Rush is 18 months old. When Finn was about 5 days old, we got some news that his newborn screening blood work came back abnormal and would require more testing. While we waited for those test results, Finn became very sick with RSV. At less than 2 weeks old, Finn was admitted into Via Christi, where he received round-the-clock care for 4 days. That was a difficult time that still makes me catch my breath when I think about it. I tell this story because throughout the time that we were there, the constant in our lives was Dr. Jessalyn Humbrell. She has become our trusted physician and friend. We have kids the same age who are good friends. Now I turn to Dr. Humbrell and our medical community for the same guidance regarding if masks are necessary for our students. The resounding answer is yes. The science says yes. This week alone, 269 children tested positive for COVID at Children's Mercy. There are 22 children in the hospital, and that hospital with COVID, a third are in the ICU. Currently, trends reflect 15 to 20% of new COVID cases are children, and we have not even started school yet, past just today. In the last week of July in Crawford County, 20 new COVID cases were in children 17 and younger. These are local families, local children. It doesn't always happen to someone else. It doesn't always happen to someone else's child. Currently, children under the age of 12 are among the most vulnerable. There are not vaccines available for these children. What science is telling us are that our local hospitals are not full of patients sick and dying from wearing a mask. What science is telling us is that our local hospitals are full of patients sick and dying from COVID. Wearing a mask is one tool at our disposal. Masks are a way to mitigate the spread of COVID throughout our community. If wearing a mask saves one child from being hospitalized, isn't it worth it? Whose child is not worth that risk? Now is the time to turn our back. Now is not the time to turn our back to professionals who are presenting us with facts that masks, in addition to other mitigation efforts that our schools are implementing, can help reduce the transmission of COVID. Preventable measures that reduce sickness and death should always be supported. This is a time we support the recommendations of the Crawford County Health Department and the back to school reopening plan. It is time to support our teachers, administrators, support staff who did a tremendous job last year and kept our schools open. There is simply no replacement in the human connection that comes from in-person learning. Let's do everything we can to support a decision made by our school board to keep our schools operating in person. Do what is right. Our children deserve better than to turn our back on science and real facts.
I'm not going to read this all for time's sake, but I did print out copies of it so you could look at it if you wanted to. Good evening. USD248 is committed to excellence in education by providing a caring, positive environment that encourages maximum academic, social, and personal growth for all students and learning experiences that promote successful integration in today's society, meeting the challenges of the 21st century. I keep hearing people say that if parents would just wear masks, their children would model this behavior and have no problems with it. Because I agree in leading by example. We have always worn masks when asked, and in August of 2020, when we chose to place our children our middle school children in Girard, we instructed them to wear their masks without complaint, not because the school has authority over them, but because as their parents, we place them under your care and wish them to respect their leaders. As they willingly and happily complied in order to attend a school which they deeply love and desire to attend, they were denied marching and formation and band class in spite of outside being the safest place. They were required to wear masks during singing and choreography in both practice and performance, even though athletes were exempt from this. They were denied participation in a chess club, which challenges them intellectually and was previously a reward. And in one class, they were denied hands-on science experiments to avoid so-called unnecessary exposure. When they heard about the possibility of regulations again this year, both of my school-loving, gifted children asked to homeschool. My students followed every rule that was asked of them, and in return, their education was punished for an illness that they did not have and was not their fault. None of our children will get a redo of last year's education. Ladies and gentlemen, what concessions are we willing to continue making in the name of supposed safety? I would like to note that according to Crawford County back-to-school recommendations that have been approved, quote, emerging evidence indicates that children, particularly under 10 years of age, are not primary drivers of transmission, and that school reopening is likely to have minimal impact on transmission between students and between students and staff. As both a student and a parent who has benefited from the school, I thank you greatly for your service on this board and to the time you've dedicated to it. I appreciate you listening to my view on this widely debated topic. My purpose was to challenge you to consider an alternative line of thinking to the one that's being followed across the country. And I beg you, as a parent who wants to leave her children in this district, and as a nurse who deals regularly with teens dealing with the pressures of this world, to please reconsider your decision. Look at the numbers that the county is ignoring, and remember that you are advocates for these children. If you have different numbers, I would love to discuss them with you. And above all, please respect the parents here today who have made a choice for their children that you are overruling. These are our children. We have their best at heart. Their health is our decision, not yours. If parents wish to allow their children to wear masks, then make them optional. But do as Girard has always done, and please choose excellence in education. Respectfully submitted immediately.
I would just like to follow up with what she said. My name is Jennifer Ange. I have 2 high schoolers. Both of my high schoolers had very bad mental health problems last year. And Mrs. Elmicki was right. One child is enough. They've suffered from so much social, and I can't explain it without crying. I took both of them to 2 different doctors to try to help them from everything they went through last year during COVID. They should not be punished. They both already had COVID, no matter what restrictions we put on them last year. I've had it. We all have immunity now. Why are we still in masks? I'm vaccinated. My husband is vaccinated. I don't see why we all have to wear masks. That's all I have to say.
Easier to do it up here so you can hear me. I'm Grace Jebber. I'm actually going to speak on behalf of my daughter. She wanted to come and speak, but she's way too nervous. She's 13, so I understand that. So she emailed me a letter. But first I do want to say thank you. My dad's on the school board where I grew up and has been for years, and I know this is like the toughest time to be on the school board. And you get both sides, and there is no win. You get anger from both sides. And so I do want to just tell you I appreciate you, because none of you signed up for that, and I know it's not. And I will say, I believe all of us are here for choice. If you were to turn it and say none of us could wear masks to school, I think the other side, those wanting masks, would be just as offended and want to fight for their choice. So I do believe we're all on the same team as wanting choices. And I wish we could focus on that. Okay, this is my daughter. Dear members of the Girard School Board of Education, since the decision that you make directly affects me, a student in your schools, I thought you should hear my perspective. This past year was my 7th year attending Girard schools. It was very different last year. These differences were not just from wearing a mask. Quarantines, separated lunch, no group projects, no spectators at sports. Although those may seem minor to you, they affected myself and my peers tremendously. We were supposed to wear masks to keep each other safe, but in my opinion, it is truly harming us from connecting with one another on a personal level, not being able to sit with your friends at lunch, and not being able to talk well through the dividers. A lot less communication can happen, which leads to unresolved problems and feelings, and harms relational connections. Think back to when you were in middle school and high school. You never thought twice about smiling at your friends, talking in groups, being able to hang out in groups, eating lunch with your group, and just being a carefree kid. Or think back to being able to go to every game at the school, supporting your friends, and just choosing a safe place to hang out after school. This was all stripped from us last year, and may continue to be this year with what you choose for us. Quarantine was really difficult, it was hard to stay on track, incredibly lonely, and most kids were behind when they returned to school. Masks are really difficult. It's really hard to hear your teachers, much less read their expressions. Being human is being able to use expressions and genuinely connect with others. That can't happen through a mask. My ability to smile at others may seem small to you, but imagine spending your whole day surrounded with masks, no expressions, no smiles. It's not healthy. You talk about keeping us safe. You aren't. We all hang out after school anyway, so you aren't limiting contact. If you're worried about liability, let us make that choice to choose our own freedom and not hold you accountable for our health. You may think that you are taking care of one type of health danger, but in reality, you're just creating a new one. Our mental health is as important, if not more important, than our physical health. Are you considering that? What can you say to the student battling depression, fear, or loneliness? Wear a mask, it'll keep you safe? No, that's making it worse. You're telling them their mental health doesn't matter. Do you want the liability of depression or something worse on your hands? I hope you take this into consideration when you're speaking for me and making decisions for me. Thank you. And again, that was for my daughter. And I promise you she wrote it, not me.
We need to write this thing down or anything like that. All right, good evening. My name is Corey Rader. I actually talked to some of you on the board. I'm a father of a kindergartner, first grader, and third grader. That's ages 5, 7, and 9. They had to wear a mask in PE today, by the way. I have one question concerning the mask mandate. My question is, how do you get a mandatory mask mandate from a mask recommendation? Dr. Stebbins is only recommending masks. How then do you guys make a mandate? Why can't the parents have an option whether or not to cover our own child's mouth and nose, the only two ways they breathe in oxygen? Please, I would love for someone to answer that. Wear the mask if you think it works. If I choose not to wear the mask, no big deal, because you got your mask on, so you're protected, right? So why force me to do it? Now, I know you would tell me that the board members aren't doctors, and I'm not a doctor, so you don't have a leader in this situation from the medical field, so you look to Dr. Stebbins. Again, he only recommends a mask. So how do we have a mandatory mask mandate? To me, it seemed like you just made yourself doctors because you forced a mandate from a recommendation. Did you guys take a vote on the mandate? Was the mandate set in place by pressure from the state and or county? We vote for school board members to represent us. I never voted for Dr. Stebbins to be on the school board. If we are letting one man, the county health department or the state, make this decision, why do we even have a school board at all to vote on decisions? The masks have nothing to do with health. It's an attack on our children. This is all about teaching our kids to comply, do whatever the government and health department says at all times. If they really cared about our health, why isn't the health department pushing proper diet and exercise? Vitamins and minerals to build a healthy immune system, not a dirty mask that weakens the immune system. Why isn't the health department calling me asking my child if my child exercised today or took their vitamin D instead of calling on their healthy quarantine status or body temperature? I was at the Crawford County Fair last week, no mask mandate at all. People on top of each other having a great free American time. Again, why can't it be optional? Is it all about the money? I think it is. Please prove me wrong. Is it about politics? Is it about power and control? Is it the fear of lawsuits? Or is it just the easy way out? Do what we did last year. Take a vote as a board. Let's see who wants the mask and who doesn't. You all say you hate the thought of putting masks on these poor kids. So please give the parents the option. I would even sign a waiver saying I would never sue the school if my child got sick, if that's what it takes. But I know why the powers that be in the state and nation won't make it an option, because if it's an option, no one will wear it at all, and there goes the leash that controls everything. The mask is the leash. Why now is there no temperature checks but still a mask mandate? Why not a mask outside like they had to this year or last year because I thought this Delta variant was way worse. This doesn't make sense at all. Do the right thing, stop this medical tyranny. Is mandatory vaccines coming next? One last question. Do you board members wear a mask all day? All day? Like my child has to? I work in a wood shop. I have to wear an N95. I know what it's like to wear a mask. My kids are very young, and I'm going to be 100% honest with you. I haven't seen any benefit from the decision of me and my wife to move here and send our kids to school here. Please prove me wrong on this. They're young. There's timing. Prove me wrong. The reputation of the school district is on the line. I've been told they don't care what other local maskless schools are doing. You're only concerned with this community. Everyone's watching now. Don't be the embarrassment. Make it optional. I demand a vote now. Thank you, and God bless you.
Hi, I'm Dr. Jesslyn Humble. For those of you who don't know me, I was raised here in Girard, Kansas, and my kids go to Girard. I actually am a physician and a mom, and I have the benefit of having a child that's in every one of our school buildings currently. I have a high schooler, a middle schooler, and a grade schooler. I'm here to talk to you about my recommendations for mask wearing and why I think that the student should be wearing a mask. In my experience as a pediatrician in this community, my experience is a lot different than what you're going to hear from a lot of people here tonight, because I am in the unique situation to where I see these patients every day. I'm having discussions with parents every day, and I've seen the difference in the types of COVID that we've seen from last year to this year. If you would have asked me last year why we were recommending masks for everybody, I would have had a completely different story for you. Last year, the reason for a mask mandate was we were wanting to protect the elderly. We were wanting to protect the people that were vulnerable for COVID-19 last year. The original strain of COVID was affecting those that were over the age of 65, those that had chronic health diseases. Things have changed this year. So last year, I would have told you that I thought by the time that we had a vaccine and that we could start combating COVID-19, that we would be able to affect the mask mandates and we could get back to normal and the children could go back to a normal life. The difference is we had a mutation in COVID-19 that we started seeing emerge this summer, and the Delta variant has came out, and we don't have studies that show everything completely yet because the studies are going to lag behind what we're clinically seeing. So what we're seeing in the clinics currently, what we're seeing in the hospitals, are going to take time to get the studies out for everybody to have all the numbers. So I've heard you guys talk about we don't have the numbers yet, but we will get the numbers eventually. And I don't want to wait and have our students be exposed unnecessarily to disease and be in the hospital and be exposed and be the patients that end up in the ICU because we're waiting on the numbers and the data. So currently what we know is that we're already seeing a rise in COVID-19 numbers in the pediatric population. We've seen that locally up at Children's Mercy. I have friends that work at Children's Mercy, and they've gone from a total of COVID-19 patients a couple of weeks ago, 15 to last week 19, this week of 22. A third of those patients are in the ICU. So this is affecting children now. We're seeing a rise steadily. I also have friends that work down at Arkansas Children's Hospital, and we're seeing the same thing there. They're seeing an increase in patients that are pediatrics that are being affected and that are in the ICU. So why am I telling you this? Well, last year it was different. We told you to protect the elderly. Now I want you to protect the children. And yes, there's a vaccine available for those that are 12 and older. So the high school kids, my middle schooler, my 8th grader, has been given the option to have a vaccine. But my 1st grader has not been given an option to have a vaccine. And all of our kids that are 6th grade and older or younger are not going to be given that option to have a vaccine. And we don't know yet when that vaccine is going to be available. Currently, the studies are ongoing to be able to determine whether or not it's going to be safe to vaccinate the children for COVID-19 that are less than 12 years of age. And we may have evidence later this year for that, but we don't know when those studies are going to be done. Latest we've heard is maybe late fall, early winter. So we're looking at most of this fall semester of not being able to vaccinate the vulnerable children that are now showing that they could be at risk of being hospitalized and put in the ICU for COVID-19. All of that said, so masks. I've heard some of you say that masks don't work and that you're worried about children having masks, not wearing them appropriately. I would counter by telling you that I saw a difference last year. I work in pediatrics. Last year, my numbers from everything declined. Our colds declined, our strep declined. We didn't even have a flu season last year.
Exactly.
That was because people were wearing masks.
No, absolutely
Give her
not.
time, give her time.
Mom, put your mask on.
How can you put your mask on?
She's talking.
So the reason that I saw a decline,
Hey, we're not gonna interrupt. Everybody got a chance to speak. Let them speak just like you did. And we're not gonna do that. We're better than that.
again, the masks were on, all the numbers went down. We didn't have a flu season. We've never had that happen before. Masks came off in May and June. We started to see a rise. I saw that in my clinic personally. We started seeing rises in colds and viruses and strep and mono and all of the diseases. We also saw a rise in RSV this summer, which is not a summer virus. So we have a peak in a virus that's usually a wintertime virus right now that we didn't see last winter because kids were wearing masks. So I believe that the masks work, and I believe that they're protecting our children, and I believe that they need to continue to wear them to help protect those that are vulnerable, because right now we have a large population of our student body that is under the age of 12 that are not even being given the option to have a vaccine. So we asked them for the last year to protect everybody else and all of us here, and now we're asking you to consider protecting them, the ones that are less than 12 that can't be protected. So we ask, whenever we all got together and were discussing this ahead of time, you guys keep blaming Dr. Stebbins, but this was not just a decision by Dr. Stebbins. He has discussions with other people in the county too, and ultimately he gets to make recommendations. But when these discussions were made ahead of time, we discussed the fact that we wanted to recommend masks for children, but it's impossible to recommend masks just for those that are unvaccinated. It makes it very difficult to say we're going to have half of the high school wear the masks that are unvaccinated, and you're going to tell me you're unvaccinated, I'm going to know that you are, so you have to wear your mask today, but you don't. That's a lot of asking for the parent or for the teachers to take on, to know who is and who isn't, to who has to wear a mask and who doesn't. What else can I tell you? What I'm seeing is that last year, whenever the parents would call me and they would tell me that they had a child who had, or typically it was the parent that would call me and tell me that they were tested positive for COVID. The parent would have symptoms and the child may have just a cough or a runny nose. That's not what I'm seeing now currently in my clinic, guys. It's the child is actually having more symptoms. And the teenagers were always more vulnerable, but the teenagers have the option to be vaccinated now. And so the younger kids I'm seeing have more symptoms now. They are getting sicker. So I just want you guys to keep that in mind and understand that when we're making these recommendations, it's not because I'm trying to be mean to anybody, and I'm sick of the masks too. I'm tired of having to wash them every day. I have 3 boys at home that don't like to wear them either. But we're not doing it to be mean. I don't want to have to wear masks forever, but I don't think the peak of the pandemic, as things are continuing to rise and our kids are getting to be more vulnerable, is the time to stop taking the precautions that are needed to protect the little kids.
Good evening. My name is Brandon Poland. I have 4 kids here in the school system, as well as a 2021 graduate of Girard High School. I'm here tonight in opposition to the mask requirement implemented as part of the return to school plan, asking that you as the board members reevaluate your decision and make masks optional, but allowing parents to choose what's best for their individual kids. I do understand the need for masks will be reevaluated October 1st. But you need to pardon my skepticism, as I'm old enough to remember 15 days to flatten the curve. It's my understanding that the board agreed to amend and adopt the county health director's recommendation into the return to school policy at your July meeting. It's also my understanding that you made that decision without fully knowing what that recommendation would look like. That may be the new norm at our federal government level, but it's my belief that it's a reckless and irresponsible way to go. For instance, what if that recommendation had come back to require all students over 12 and all faculty to vaccinate before returning to school? What would you have done then? Would you have fully backed that recommendation, or would you reverse that decision tonight? If the answer is yes, it is not too late to change the policy and make masks optional. Leading up to your vote in July, did you reach out and contact community members and stakeholders to see what their thoughts were, or did you simply follow the science of masks? I've not had a lot of conversation with board members in the past regarding masks and masks last year. I did have conversations with a couple, and honestly, I thought masks were probably the prudent thing to do early in the pandemic. But as we've gone along, my thoughts have changed a little bit. Vaccines are available, and there are other options as well. I'm also a little bit opposed to saying that we're masking to make sure you don't get quarantined. And whether that, if you're an athlete, we would hate for you to be quarantined during your athletics and miss athletic performances, or we would hate to have you miss your drama and forensics meets, FFA meets, whatever. And that's fine, it's okay. And I heard my high schooler say that today. Multiple teachers have told them, we're masking so you don't get quarantined. And unfortunately, that's our decision, not a teacher's or school district's decision, is my point. And I understand we don't have a desire to have athletes or performers miss their performances, but again, to me, that should be a parent's right to make that decision. Our schools were open all of last year, and for that, we should be proud. I do think we should be commended, because I'm sure it was an extremely difficult year to go through that school. But I also know that Columbus schools were open all year without masks. Wichita Public School District has opted to make masks optional this year. Wichita, with roughly 47,000 students and nearly 77% of those students coming from homes of poverty, where they probably live with multiple generations of family members. Locally, Carl Junction, Uniontown, Northeast, and Colgan have also chosen to make masks optional, and there are probably others that I'm not familiar with. I would guess there's been pressure, whether directly or indirectly, from other area schools to follow their lead in masking, so everyone in the county is on the same playing field. My call to you is that you reconsider your prior decision, making masks optional and letting parents decide what's right for their family situation. If you'd like to contact me personally, Mr. Bauer has my contact information, and I'd be happy to have that conversation with you personally. Thank you.
No fancy write-up. I wasn't expecting to speak tonight, but I'm John Weir, working to the local post office. My wife back there, this all sounds so absurd to me, because my wife is a daycare provider. We run an in-home daycare, everybody, and they are not required to wear masks. There's probably 8 to 10 daycares, I'm giving a rough estimate in this town. They are not required to wear masks. We've got 10 to 12 kids in our home. I go home on my break. I don't wear masks. There's kids in a room, in a living room. We aren't wearing masks. Babies all summer long, they aren't wearing masks. We took them to the Crawford County Fair on a field trip last weekend, not wearing masks. I mean, so how are they being forced to do it here? Like I said, I think it should be a choice. I've got 2 daughters. I've got one in 4th. She's different than the other rest of us. She's a socialite. And if given the choice, she might wear the darn mask. But I got a kindergartner that started this morning, and she takes after me. Anybody that's dealt with me over the counter, I'm pretty soft-spoken. She's a lot like myself, shy. We're excited to get her into kindergarten because we're hoping it'll open her up a little bit more. These masks aren't going to help her whatsoever. I'm afraid growing up, starting out this way, she already went to pre-K, having to deal with this for half a day. Now we're going full days. We don't know what it's going to do to her mental health starting out. And I know there's numbers being spoken about, or lack thereof numbers that are coming in. We don't know what these things are going to do 10 years down the line to everybody. I haven't watched this in probably like a month. I know people do the same thing. We don't, it's, I don't know. Like I said, I wasn't expecting to talk, but being in a situation where I live at a home every day, we haven't changed our way of life. We've, like I say, 10 to 12 kids in our home a day, no social distancing. That's all I got. I don't know.
I'll start out by saying I'm an emotional person, if you know me, and so if I don't make it through this without crying, I apologize now. I want to start out by saying I have a family member, a friend, acquaintances, and one of my favorite middle school teachers on this board, so please know, do not take this personally. I understand that you are a school board, and you are doing what you feel best by mandating a mask, so please understand I'm a mom and doing what I feel is best for my children. As a school board, you should be concerned about how many parents, like myself, are moving their children from USD248 because of your mask mandate. Our son was supposed to start his senior year at Girard today, but because of your mask mandate, he is not attending Girard. For the first time in 20 years, I don't have any of my kids at Girard School, and this is concerning. This is where my husband and I grew up. We graduated from Girard. We call this our home. What is going on? Why are we so divided? Listen, if you want to send your kid to school with a mask, that's your choice, and I respect that as a parent. I get it. But I don't have that same choice. I can't send my kid to school without a mask to Girard. Last year, when my 9-year-old heard that Columbus wasn't requiring masks, she said to me, "Mommy, I can make new friends, but I can't wear a mask." I watched her walk up to a new school that she had never been in, didn't know any teachers, and didn't have a single friend. I cried because I was so worried about her, but mostly because I was so damn proud of her to have the courage to leave a school that no longer met her needs and go to one that did. She had a wonderful year and will start her second year at Columbus next week. Why can't we take what Columbus did and apply it here? They did temperature checks in the morning. They kept desks clean in between classes and frequent hand washing. Weather permitting, they had specials and lunch outside. A bonus was birthday parties, and you could even bring treats. She brought treats for her birthday. They dressed up for Halloween, and they celebrated all of the holidays. Girard did not get that. They even went on 2 field trips. The list goes on, and what it comes down to is they did all of that without forcing masks on children or their staff. Cherokee County did not have higher numbers. In fact, by population percentage, Cherokee had 14.28% of their population have COVID, and Crawford County was 14.91%. So if all that masking didn't get you a lower number, then why are we putting these kids through masks another year? To the school board, I urge you to research in the rise of depression, anxiety issues, suicide attempts, and suicide in children these last 18 months. I urge you to hear the pain and concern in these parents' voices. We are speaking from our heart for our children. To the parents, I urge you to stand up for what is right for your children. You know what is best for your children better than this administration, this Board of Education, and Dr. Stebbins. Don't be afraid to take a stand. Enough is enough.
Hello, my name is Sarah. I have 2 boys in the school district. I definitely was not planning on speaking tonight. But I'm sitting back there and I'm hearing so many people's personal experiences, so many people's stories, and everybody has one. Everybody has the worst case scenario, and everybody has their experience of when they had COVID and nobody in their house and nobody else got it and nobody wore a mask. So instead of personal experiences, we keep saying, follow the science. Where is the science? Tonight I have not heard really any science except for one of our first speakers who quoted from the CDC about some of their studies. So I don't think anybody disagrees. We have a new variant. It's attacking children. It is higher transmissible. It is lower severity. We have lots of kids in the hospital with COVID, with RSV, with lots of different things. But we keep talking about the science, and I'm not hearing any science. I'm hearing a lot of emotional talk, a lot of personal experiences, and quite frankly, it feels like the science keeps changing. At first, it was wear a mask when you're not able to social distance. Now we're all social distancing. I work in a state office where even if I'm the only one there, I have to continue to wear a mask. So where is the logical thinking? It seems like logic has went out the window. I work in a state office where we have 3 bathroom stalls. The middle one is closed for COVID. I'm not kidding. There are stalls that divide us, and now instead of 50 people using 3 stalls, we're using 2. So to me, statistically, the rate of spreading COVID in 2 instead of 3 stalls goes up. So my question is, where is the logic? Also, where's the studies on the masks? Do they work? Don't they work? Masks aren't new. Viruses aren't new. COVID is. Viruses aren't. So where have the studies been? Are masks effective? Are they not? And then just logic. I'm going to hang out with so many people in this room, probably in the parking lot, with no mask. Our kids are hanging out every night without masks. My kids might be visiting some of you guys' kids' houses without masks. My kids have been doing that all last school year, all summer, without masks. So also the science of how is sending them 8 hours of the day, masking them up, social distancing them, but then they're all exposed to each other right after school. How is that really affecting them? Lastly, I wanted to talk about one point that last year I thought was actually really stupid. I had parents talking about feeling scared for their children's well-being and depression and whatever from not seeing smiles, and I'm like, suck it up, Buttercup, it's 1 year with a mask. I don't agree with it, but I thought that was really silly. Until recently, I actually investigate crimes against children for work, and so I do interviews with those children when there have been allegations of abuse against them. I have had most of the time, parents and their student comes in, they see I'm not wearing a mask, they all take their mask off. And so I have only had one interview that I attempted to interview with a mask on, and that's because the child did not take hers off. It became very clear to me how important that nonverbal communication is when dealing with children. Up until we know that, what is it, like 90% of communication is nonverbal, but up until that moment, I did not realize how much this mask was hindering my interview. My nonverbal communication could make or break an interview. My nonverbal communication could make or break if a child feels safe, or if she's scared, or if she's comfortable. So now all of a sudden, I'm on the emotional bandwagon of I don't know how many kids are in your school who need to come here and feel safe or feel comfortable, and when you reprimand them, they need to see your face. They need to have human interaction. So I admit I'm on the bandwagon now. Thank you.
I am a horrible public speaker. I will talk very loudly. Here's one of my problems. I have a lot of problems with this. The first one is, yes, I'm sitting in the back. I'm watching. 90% of the people in this room have touched their mask. One of the first few speakers touched the mask during her speech, played with the microphone, and put it down. Everyone else who's come up to speak, I'm sorry, I'm the girl that takes her pen everywhere with her. If anybody of you been shopping with me, I don't touch their pen. I don't touch the pad. I'm a germaphobe according to some. The masks don't work. You read the box. I read the box of 3 different masks today. The porosity of the masks are too large to stop the virus. The box says it right there. I don't want to harp too much on that because I don't want my kid in a more restrictive mask. I know a child. Is this only one? Yes, I know a child who now has a permanent lung condition that the doctor directly attributed to a lack of oxygen. My kid is in every sport with a ball. He needs his lungs. If for no other reason than to argue with me because I get so loud. Another point that was brought up was, I choose to send my kid in a mask. I choose for my kid. I want my kid in a mask. Please, if that is your decision and your child's decision, wear a mask. My child's not given that choice. And we have all of the equipment to do temperature checks. Why have those been abandoned for this year? We can do temperature checks. I've seen data from the school districts last year. There were no COVID transmissions in at least Arma and Girard school districts. I can't speak for Pittsburgh. I don't know. But there were no transmissions last year of COVID in Girard and Arma. Everybody wore masks. Everybody had temperature checks. The data I want to see is how many kids were sent home from school because mom said, oh, you're fine, I've got to go to work, go to school. And they came to school with a temperature. I'd be interested to know that because I think that's great preventative work. That's not invasive. Am I crazy about the gun pointed at my head when I go somewhere? No, but I've seen the monitors that you put your face up to. Get them back out. To slow everything down? Yeah. My kid's worth slowing down your day. My kid's lungs are worth protecting. Like I said, I'm a terrible public speaker, but I can be loud, so thank you.
Hi, I'm Lisa Wells. First of all, I want to ask anybody if they have a spare couch tonight because I promised my husband I wouldn't talk, and I'm up here, and so I may need to sleep on somebody's couch when I go. I just want to speak really quickly from a teacher perspective and a parent perspective. First of all, from a teacher perspective, they are doing the best they can with everything they are told to do. I don't teach in this district, I teach in another district, and I teach pre-K. Every child in our building above the age of 2 are required to wear a mask currently. So, that doesn't mean that I agree with it, but as a teacher, I promised my parents I would do everything I could to keep their child safe. Okay, so with that said. Now from a mommy perspective, I have 2 high schoolers here at Girard, and then I have a little guy that is in 2nd grade. At the beginning of the pandemic, I said, hey, if we need to throw on a mask to keep everybody safe, do it. No big deal. Where I came into a problem with it was in May. Our county was in the green, and it was really hot outside. And if anybody knows our little guy, he's very energetic. And his favorite thing to do in the world is talk. I don't know where he gets that from. He tries his very best to sit still and keep his mask up and listen to his teacher. You do that for 8 hours every day with a mask on, and that wears on you as a 6-year-old child. They were wearing their masks outside. I don't understand that. I don't know what the policy is on that. I don't know if that's in every classroom. I couldn't understand that part of it.
where it was 80, 90 degrees outside and my 6-year-old had a mask on. I was in my classroom last year teaching, and I have a very great relationship with his teacher. She was wonderful. So don't get me wrong, I don't blame the teacher. He's a lot some days. All year long, if she had an issue, she would text me, call me on my cell phone, or email me at my work email. That was our way of communication. This little guy had never been in the principal's office. He's social, but he's not naughty. I get a phone call in my classroom phone. That has never happened. It said it was for my son. I'm in the middle of group with 3, 4, and 5-year-olds. I drop what I'm doing and I run to the phone because I thought he was in an ambulance on the way to the hospital. Come to find out, he was in trouble because he wouldn't keep his mask up. He had been pulled into the principal's office for 2 days. I was not told about the first day. This is how I found out about the second day. And as I'm speaking to the principal, who is very nice, by the way, I realize I can hear reverb on the other side of the speaker and realize I am on speakerphone. I was not told I was on speakerphone. My son was in the principal's office in a chair on speakerphone while his principal called his mommy at work to tattle and tell her that he did not have his mask up because they thought that strategy would be effective to get him to keep his mask up. So I politely asked the principal to take me off of speakerphone. I feel that that situation was handled wrong, mask or no mask. What you believe is what you believe. I do not want to be called out of my own classroom with my own students thinking my child was hurt, because I'd never been called before like that, to be told on a 90-degree day when our county is in green that he wouldn't wear his mask. Maybe you disagree and don't see anything wrong with that, but that was very hard to swallow as a parent and a teacher. I would never call a parent with a child in the room and put them on speakerphone to discuss what I feel is a discipline issue. This is what I worry about this school year. My guy is super social. He loves everybody. He's a happy-going little guy. If you don't like him, it's probably because he won't stop talking. Today, when I dropped him off at school, the only issues he had at home this morning was over his mask. He didn't want to wear it. He's really picky. We must have not bought the right one. It wasn't comfortable. His whole morning ended up being revolved around a mask because he was nervous. He didn't want to wear it. After the instance in May, it took us 2 or 3 days to convince him he wasn't a bad boy. He cried for 2 days because he thought going to the principal's office meant he was a bad boy. And it took his daddy and myself and his 2 sisters and his grandpa to convince him he's not a bad boy over a mask. So can you imagine the anxiety he had going into his 2nd grade year? Instead of being excited about seeing his friends and meeting his teacher, he was worried about how he was wearing his mask. Mommy, is it above my nose? Mommy, is it straight? Mommy, it keeps sliding down. Can we keep it up? Because he doesn't want to go to the principal's office and be a bad boy. He said to me this morning when we got in the truck to go to school, and I had to hold back tears, "Mommy, I wish school was over in 2 minutes." Why? Because masks are not appropriate. And he's 2nd grade and uses words like that. I didn't know what to say. Because I'm a firm believer, if you don't agree with the rule, it's still a rule and you do it. All right, thank you guys.
Anybody else?
Go ahead.
My name is My name is William Sarton. I'm a lifelong Girard resident and a graduate of Girard schools. I went to school with many people in here, including many of, at least two of them on the board. And I just want to say thank you for the education you guys have given me, and I want that same education for my kids. I got a daughter that's now that's in second grade, and my son is now in fifth grade. My daughter's kindergarten year was cut short because of COVID, and throughout that year we had noticed that she was a little bit behind. She's probably one of the youngest kids in her class. It's a July birthday. So we were working with the school to get her extra help in learning to read and speech and stuff. But then that was cut short and we were homeschooled. When we were excited to get to go back to school the following year, but throughout the year we noticed there was minimal improvements in her reading. And we had several interventions with the principal of the grade school and the teacher, and we were told that everybody in her class was behind at that year. And I can't think of any other reason that they were all behind, regardless, other than being shorted 2 months the previous year. Now with that, going on to the topic hand of mask, the whole year that my daughter was in first grade, she always complained that she couldn't hear the teacher or the helper very well, because when you wear a mask that is actually effective against this virus, it muffles your voice severely. Many people have masks like these that you can see through. So you know they do minimal good, if any. So I just want to ask the board to carefully consider placing this option back into the parents' hands, and focus on, and this is for the whole school, focus on educating our children. I did not go to school to be an educator, and right now we have 2 kids at home finishing out a week of quarantine. They will not be able to start school until next Friday. And when I walked in the house tonight, my daughter, who's working on reading, was crying because she doesn't get it right now, and we don't really know how to teach her that. So that's a struggle we have as parents. Her mom and I both went to career fields that were not teaching related. So when we have to homeschool our kids, we need all the help and backup we can get from the school side of things as well. And frankly, over this last year, we did not get that very well. So I would like to just see the focus back on education and put the health and safety of our children back in the parents' hands. As far as decisions with masks, and in the future, if vaccinations become mandatory, which I hope they don't, put that option back in the parents' hands too. And this opinion is mine and mine alone, and I'm here as representative of my 2 children. Thank you.
Lori. I don't like to talk in front of people. I'm much better on social media, but my sister can't make it today, and she asked me to read her letter. So, my name is Kim Kravitz, and my sister's name is Nema Hartley. Her letter is, I'm speaking today on behalf of parents of special needs that attend Girard schools. For many, masks are dangerous for their conditions. For example, due to my daughter's condition, dystonia and one I can't pronounce, her body cannot regulate its temperature. This means after a short period of time in a mask, her temperature goes up as high as 101. Now between this instance for all the children to be masked in Girard and the state of Kansas taking away the option to virtual classes, there is a removal of the right for children to have free and public education. Nema says, I was fortunate enough to be able to homeschool Kiva last year. However, with that comes a loss of her special education services. With no pediatric therapist in our rural area, this means she was without her physical therapy and occupational therapies for over a year. This resulted in a loss of skill and the possibility of Kiva having a repeated hip surgery. My sister would like to implore this board to reconsider their stance on masks, make them optional at the very least, provide a medical exemption for those who need it. Thank you, Nema Hartley. And for my own personal self, I promised Ms. Wells, like you, I promised my husband I wouldn't speak, but I watched most of you out at the fair all week long with no masks on. And I understand that it's outside, so maybe it's a little bit different than inside. But for people to come in here and request masks to be worn, and last week you didn't have one on, feels very hypocritical. And it's just not fair to me. And then also, like Amy said, I encourage you all to have confidence to pull your kids out if you need to. We pulled Kelsey out last year. It was a hard decision because we moved back home for Girard schools. It's a wonderful school district and I love it, and it's home for me. So if it's not fitting your needs, have courage to pull them out. If not, then send them back. But for my sister's sake, just consider your special needs kiddos that go to this school, because Kiva is missing out. Thank you.
My name is Ruth Dooling. I'm the CEO at Girard Medical Center, and I appreciate all you folks being here this evening. I think it goes without saying that there's a huge amount of care and concern for the kids of our community, and I think you should all be applauded for that concern that you're showing. I think my comments tonight are a little bit of a different nature. I think my comments come from a little bit different of a concern. I want you to know that your local hospital is at capacity. So, and that's due to the increase in COVID positivity in our area and in our community as a whole. It's not necessarily because of the number of patients we have at the hospital, but it's because of the lack of staffing. And all of that comes from the increase of COVID throughout our community and the area. Our staff is really busy. We're doing a ton of COVID testing every day. We test from 8 to 2 every day, and there's a lot of that going on. We're doing lots of monoclonal antibody infusions. That happens on a daily basis as well for those patients who test positive for COVID. I feel like any measures that we can take as a community to reduce the spread of COVID should be taken, and that's why the hospital supports the Board of Education in their mask mandate. I'd also say that I think the added benefit of keeping children in school is a positive thing as well. If we have to close school because of an outbreak in the school and kids have to go home, again, I think that's definitely a negative thing. I would tell you that I make these comments through the support of the CDC, of KDHE, of the American Academy of Pediatrics, and our family practice physicians at the hospital too support the board as well as our board of directors at the hospital. And that's, you know, all of our family practice doctors. Dr. Stevens has already made her opinion known, and we respect Dr. Stevens' opinion for that as well. But the other family practice physicians do support the board. And I want you to know too that we have COVID vaccine at the hospital. So if you're wanting to get a COVID vaccine, that's available. We can give it to you any day of the week. Reach out to somebody at the hospital and we can make that possible. Thank you.
Represent CDC, correct? That's what you just said.
No, I said the CDC is recommending masking as well.
Okay,
I'm
but
sorry
you
if
said
I
you
mis-
represented them.
No, if I did, I'm sorry. I do not represent
I
the
just-
CDC.
Just wanted to make that clear.
That's fine. If there's any confusion, I don't represent the CDC.
Okay. I'm Tony Anderson. Every year I go through OSHA training with personal protective equipment. And I've done it for the last 3 years. And we go through it, and if you read your boxes, they say they don't stop a virus. Well, that's true. Proper OSHA PPE for virus is level B. Level B is rubber boots, Teflon Tyvek suit, taped, rubber gloves taped at all seams, face shield with a charcoal respirator, and a hood. If you want to get right down to what stops COVID, that is it. If you ever see them working with the virus or anything like that, you'll see them in level A, which is with an air hose going to them like scuba. But for practical purposes, if you really want to protect for yourselves from COVID, it's level B PPE. That OSHA's been around and been a lot more accurate than the CDC has. They've been around a heck of a lot longer, and they actually do testing on this equipment constantly. And they're always revising. So, I mean, this, you know, it's kind of like they used to say about the pink eye shot in cattle. It makes you feel better than it helps. You know, I mean, this is just, so that's about all I got to say.
Anybody else?
I'll just talk back here. My name's Dan Shireman. A lot of you know our families. I've worked in the healthcare industry too, oversee a laboratory with Memorial. COVID is a droplet virus. Yes, these masks, surgical masks, do not stop the virus, but they are cutting down the transmission of the droplet. Both you give it to somebody else and somebody back on contact surfaces. I commend the school district for doing what they can to try to mitigate the spread. Kids are not, they have a very low mortality rate. They are mostly asymptomatic, meaning that they don't express a fever or any other condition. That means that they can come in, spread it to another individual, a teacher, staff member, and take it to their family and just continue the pace. So I commend the board and the school district for doing what they can. Yes, we all have our own choice of what we want to do at home, how we feel about vaccines or masks other places. But at least the school is trying to do what they can to help the community the best they can, and to help the healthcare professionals in the area, to help the schools and the students. So I commend you for that. Thank you.
Anybody else?
And you haven't talked very
Okay, you talk about somebody that doesn't public speak very well. That's me. So I'm gonna keep it really short. I just want to say to the board, if you're gonna implement a rule that my children have to follow, then I challenge you to follow that same rule. So every Monday through Friday, every day that my child is in school, my two children, you too need to put a mask on at 7:45 in the morning and don't take it off till 3:15 every day. Don't implement rules you're not going to follow. Thank you.
Hi, my name is Sherilyn Plotnick, and I have two children in the Girard School District, a 10-year-old and a 14-year-old. My personal experience was my son contracted COVID in February. Our family did, all except for my 14-year-old daughter, who was in the house with us the entire time. This is also the same child that was quarantined 5 times during school last year, for 2 weeks at a time. When my son went through the COVID, we were sick enough to stay at home. We were not sick enough to go to the hospital at any point. We managed to get through the COVID. Everything was fine. We came out of quarantine. We were at home, and he was back to school for a week. After a week of being back to school, he contracted massive headaches. Every day. They would not stop. Any day. The entire month of March, he missed school because we chased doctors and trying to find out what was going on with him. It was the worst month of my life. At one point, we thought he had a brain tumor. He had 3 emergency room visits, 2 hospitalizations, and every lab test you can imagine, along with MRIs, CTs, everything. We made 3 trips to Children's Mercy before they finally hospitalized him for 3 days and kept him under sedation for a day and a half. My point is, he wore the mask the entire school year. It did not work. He still got COVID. That's all I have to say. And now, I will add, now, he still has lingering problems. He still gets headaches. He's very, very weak at times. He has pains, multiple pains everywhere. He's been diagnosed with amplified pain syndrome left over from COVID. Even with everything that he has gone through in the last 6 months, with all of this, before I left home tonight, he asked me to vote for no masks.
Lauren Murphy, and this was my first day at GHS. I'm a freshman this year. And I'm just going to say, last year I did the online school option. It was optional. And it was just because I chose not to wear the mask, and because, you know, if I was going to go to school, I was going to comply, and if, you know, because I had the option. So it was hard, you know. And a lot of kids did not like the online. I personally did. So obviously this year was not an option, and I chose to go back. And it was a long day, really. I wasn't used to it, but I kept it up. I complied. And I just thought it was kind of crazy because we had the mask breaks, but instead of like having like where you space out and do all this, you stayed in your seat, pulled down your mask, 5 minutes. When that 5 minutes is up, you pull it back up. What good did that just do? You know? I thought that was just something that just kind of caught my eye. Well, anyway, speaking of the mask, we live day to day. We're humans. And I just think to myself, you know, I could walk outside and get hit by a car, you know. So my sister, she is a diabetic, and she has high blood sugar and low blood sugar. And we don't sit there and we watch her blood sugar all day. We do, and we got to be cautious, just like the coronavirus. But you know, we have to live day by day and make sure that we're healthy and safe, and that's all we can do about it. You know. Thank you.
May I make one correction on the thing? ARMA does require masks. They're gonna.
ARMA is
review it.
mask optional.
No.
ARMA
Yes, it
is,
is.
yeah, they changed it.
They changed it. I just found, cause see, I sub in ARMA at Frontex.
Girard is mask, Pittsburgh is mask,
Frontex is,
and Frontenac is mask,
Yes.
that's it.
and well, all the Crawford County schools except Colville.
Correct. But
Right.
not all Crawford County schools are following, they should all do the same thing.
They should.
You're open that door.
Well, thank you all for your comments. Turn it back over to you.
Thank you, everyone, for coming out and sharing your comments. They were all valid points on both sides. I would think you would know that we agree and disagree because it's such an emotional topic and there's a lot going on. We will take this under advisement as a team, and we'll just see where it goes from there. But I wanted to allow you to stay if you'd like to stay for the rest of the meeting, or at this time, everyone can go on out if you want. It's up to you. We're going to continue on with our next agenda items. Thank you.
God bless your souls.
Moving on to agenda item number 8, approval of donations. Mr. Girard?
I recommend we approve the donations that are in your board agenda. We're very thankful for these people that are in support of our schools.
So moved.
Moved by Dave. Second by Peggy. All in favor, say aye. Opposed, say nay. Motion carried. Thank you to our donors. We always appreciate the continued support of our school district. Agenda number 9, 2021-22 USD248 proposed district budget update.
If you remember correctly from last meeting, everything's been bumped back a month. Typically, we approve the budget at this meeting, but with some changes in statutory regulations, that's all been backed up a month. We did meet, John State and visit with you and kind of through the preliminaries for our budget. And we did meet with Dale Dennis on the 28th of July. This was what we proposed and looked at the last board meeting. This was what we would publish in the paper if we have a consensus. A couple important notes, the budget hearing will be at 7:05. Why 7:05? Because this year you have to have a revenue neutral hearing. Prior to that, that needs to be at 7. I'm just gonna highlight a few things though, a few things I'm pretty proud of. You understand the mill rates, and our mill rate has been slightly less. Look at the total USD expenditures going from the previous years. It's gone down a little bit, but the thing I'm most proud of is we always sold and talked about the bond issue interest rate. We'll keep that at 12 mils or less, and we've been able to back that off. Good decision making on your part. So if you're good at that, I'd recommend that you have a consensus, and we will get this posted in our paper.
Mr. Bauer, could you, Beth Murphy is not able to hear.
She can't hear anyone.
I'm not sure.
Can she not hear
Beth?
because she just can't hear me, or she just, it's not?
I'm not sure. Just a moment. She said she can barely hear. Do you want to use the microphone? Would you be able to use the microphone?
Yes.
Thank you.
So, agenda number 9, motion to publish the approved budget. Proposed budget.
9 is an action item?
Just to get census, just
Oh,
for
just
the
to-
record,
okay.
that you know
All right.
that this is what we're going to publish in the paper.
All right.
And the approval of the budget will not happen. Approval of the budget will not happen until the September meeting.
Agenda item number 10, establish a date.
And what we're publishing is our proposed budget. We have the budget hearing at the regular scheduled board meeting in September at 7:05 p.m. That's what will be in the paper.
So moved.
Moved by Dave to accept the budget hearing date of September the 9th at 7:05 p.m. Second by Roger. All in favor, say aye. Aye. Opposed, same sign. Motion carried. Agenda item number 11, establish a date for the 2021-22 budget revenue neutral rate hearing.
As you know, and I think we've gone over this quite extensively the last board meeting, but this is a new thing for us, for everybody. But I'd recommend we establish the date for the proposed 2021-22 budget revenue neutral hearing on September 9th at the next regularly scheduled board meeting at 7 o'clock p.m.
Motion to establish the date for September 9th at 7 p.m.
You move it. Kelly moved.
Moved by Kelly.
And I second it.
Second by Peggy. All in favor, say aye.
Aye.
Opposed, same sign. Motion carried. Number 12, agenda item, return to school guide update.
I'm going to update you on some of the changes that have occurred, and I also want to have an opportunity. Katie Van Cam is here from Crawford County Health Department, who we visit with quite regularly, and I wanted her to have an opportunity to present some information to you. And then I'm going to give a follow-up on some things that have been impacted. Katie?
That's okay. So tonight, my purpose here is just to give some general information from the health department, and also to kind of run some numbers past you. And I did this for the Southeast School Board on Monday. And what I kind of want to start out with was just the fact that the last year and a half has been very, very difficult on everyone. COVID has touched everyone. There's no one that it hasn't touched, that it hasn't been an issue for. And kind of go over a little bit, when it first started in March of 2020, Crawford County wasn't very effective. We were all ready at the health department to, step in and start doing, the investigations if we needed to. We were kind of ready, and not a lot happened. A few things trickled in.
where we saw it was in June of 2020. And the first outbreak was really at a meatpacking plant, and we really got slammed. Spent lots and lots of hours there, sometimes a lot of 12-hour, 15-hour days, just trying to keep up with investigating all of the positive cases that came in. So then our next spike, well, cases started to come down. Our next spike was in September of 2020, and that was when school started, and when, especially when PSU came back, as their students came back in. So we saw, again, a very, very large spike. So then things started to calm down, and then of course the holidays came along. So November, December, Thanksgiving, Christmas. So December, there was one day in December that we had 103 new cases that day to investigate. So we worked very hard with that. And then that peak lasted a little longer. Instead of the average of 8 weeks, that one lasted more like 12 weeks. Then things again, and in May, we were extremely excited because in May, we started going to single digits as far as new cases in a week. So that was extraordinary. In the first part of May, May 2nd to May 8th, we had 10 new cases that week. The following week, we went down to 3. The next week, 6. The end of May, we had 8. Then we started into June, and we jumped from 9 to 22 a week, then to 27 a week, 51, 53, 93 a week, 167 that week. Then it went to 210. That was the week of July 18th through July 24th. So the following week, we went to 230 new cases that week. Then we dropped last week to 186 cases. So we were happy that at least we'd gone from 230 to 186. This week so far, so just Sunday through today, we end our day at 3 p.m. So we go from 3 p.m. to 3 p.m. So far this week, we have 133 cases, new cases. That's a lot of people. So for our county, for Crawford County, these numbers are just for Crawford County. At the health department, we are looking at what's going on across the entire country. But what Dr. Stebbins and I look at are what we pay more attention to is what's happening right here in Crawford County. What's happening with our people. So right now, total in isolation in Crawford County is 282 people. So that's 282 people that are sick with COVID. And then 846 people are in quarantine because they've been exposed. A lot of those people will end up positive. This is the difference we're seeing now from last year. Last year we would, and I guess maybe I need to back up just a little bit again. Every single positive COVID case comes to the health department. When someone is tested for COVID, the results are sent through a portal to KDHE, Kansas Department of Health and Environment. Then they send those positive cases to each county. So it's a program called EpiTrax. So every day we get the new cases that we have to investigate. And what the investigation, what that entails is we call the positive person to see how they're doing, see what day their symptoms started. Are they getting worse? Are they getting better? Who they've been in contact with, so that we can make sure those people quarantine so that they don't go out and unknowingly infect others, because they very well may be positive. Last year at this time, we would see 1 or 2 people in a family become positive, but not necessarily the rest of the family. Now, since July and since the Delta variant has been here, when we see one person in the family sick, within 2 to 3 days, typically the whole family is sick. And the reason being, same COVID-19 virus, but with this Delta variant, it's made it so much more transmissible. It hasn't necessarily made it more virulent, but much, much, much more transmissible. So we're seeing more cases and we're seeing whole families get sick, which is hard too, because it's hard to take care of your children when you're very sick. And a lot of people are getting very sick. And I think Dr. Humble approached this too, that we also have to look at our, look at our healthcare systems. And right now, Girard, via Christie, they are many times at their limit, what they can hold as far as positive COVID patients. Sir, I talk to them every single day.
She just sat here and said it wasn't because of the cases. She said it was because of the staffing issues.
But anyway.
The staffing issues, not the cases. You're
No, sir. It's
you're speaking out of both sides of your mouth.
Hang on a second. We're gonna keep corn here. Go ahead and speak.
She's talking to me, so I can rebut.
Bed availability. Not staffing, bed availability.
That's not what she said. She said staffing.
Anyways, there has to be a bed to put a sick person in. If there is not a bed to put that sick person in, then you're trying to find some place to send them. The biggest problem is there's not beds in a lot of the other hospitals either. A lot of this started in Springfield, this Delta variant. We saw it with Springfield, started having, all of their hospitals full. When you see a town, an area that size, filling up and nowhere to put people. And then it just kept moving west. So then it hits Joplin and Webb City, continued to move west, and it's hit us. So there's also that issue to look at. We have to look at our medical capacity and how are we going to keep taking care of these individuals becoming ill. And right now we have, in Via Christi, we have 3 people on vents that are COVID positive. So all of this comes into play. So what do we do to try to make sure people don't get sick? It's hard. And mask is just, it is one tool in the toolbox. Yes, can a virus get through? Yes. Oxygen gets through too, and CO2 gets let out. They're very, very tiny molecules, they get out too. What the mask does is it prevents the large droplets. So what you look at is viral load. The larger the spittle is coming out of your mouth, the more virus that's in it. So, that does make a difference. If both people are masked, if you're masked and I'm masked, a lot of that has been cut down. Not totally, but it's been cut down of how much virus, reaches the other person. Distancing is important. The other big thing that's important is hand hygiene. And that's kind of like, in the 70s when I went to nursing school, that was the first day of nursing school, they taught us how to wash our hands appropriately. Because good hand hygiene is key to almost anything. We get for the flu, for whatever, So there's a lot of tools we can use. The biggest tool we have is the vaccine. Unfortunately, we have a lot of vaccine hesitancy between the ages of 25 and 45. Everybody has the right to make a decision. I'm not saying that they shouldn't have that right. They should. This is America. They have that right to decide to take the vaccine or not. But our little ones don't have that choice to have the vaccine. Parents can decide for their older children. And with this Delta variant, we are seeing more kids get sick. We didn't see it as much before the Delta variant, but we are seeing it. we have the numbers. Every positive case comes to our department. We talk to every single COVID positive person. If we can get a hold of them. Some people don't answer their phones because they know why we're calling, and that's true. But we have to call them and make every attempt to call them. And then, talk with them to see how they're doing and then get in contact with their contacts. Not everybody will share their contacts with us because a lot of people don't feel it's our business. But it is our job to try to protect. The health department's here to try to protect health, try to protect people from getting sicker than they would have to. It is a tough disease. And a lot of people don't make it. We've had, since COVID started, we've had 94 deaths in Crawford County. 8 of those deaths have been in the last 5 weeks. And they've been in some pretty, not children, but they have been in people in their 40s and 30s. Very healthy people with no underlying health conditions. So it does happen. We know we're seeing more. So to tell you, on Monday, when I ran the figures, we had 68 children between the ages of 0 and 9 COVID positive. We had 80 children between the ages of 10 and 17 COVID positive. Today, we have 80 children between the ages of 0 and 9 positive, and 92 between the ages of 10 and 17 positive. So we've jumped 24 more children positive just since Monday, from Monday to today. So we are seeing it more in kids. And we really don't want to. This is our rating. As far as vaccine rate, we're doing pretty good. There's 105 counties. Crawford County is number 31 in the rankings as far as vaccination rate. As far as testing, we're 44 in the county. And there are many, many places, and I can give people all that information of where to be tested. There's a lot of testing sites in the county. When it comes to positive cases, out of 105 counties, we rank 102. We're a big hotspot. Dr. Stebbins and I thought when the numbers came down in May and we were in those single digits, there was a recommendation for no masks during summer school. And it was awesome, and we were so excited. And really thought if that trend continued, we would possibly be able to say, don't need a mask when school starts. And that was really what we were hoping for. But when the Delta variant showed up and the numbers changed, then that's when we had to really look at it and be concerned about people here in Crawford County. Not in Illinois, not in California, but here in our county. Our masks aren't going to prevent everything, and we know that, but it is a tool that we have. Masks, good hygiene, vaccine, and just good all-around cleaning. Cleaning of tabletops and utensils that a lot of people use, and that type of thing. So that's what I've come to with. I also encourage people, if they haven't been vaccinated, to maybe to reconsider. Do your research. Think about it. We do have some breakthrough cases where people do become ill, especially if they go into, I'll give you an example. We had a woman in her 30s. She fully vaccinated, went to Nashville to a big concert, came back positive, but her illness was like a runny nose and a slight cough. Because she'd been vaccinated, the illness was extremely mild. She still needed to quarantine just so that she wouldn't pass that on to anyone else. But the whole idea with the vaccine too is you may still get a mild illness, but most likely you're not going to end up in the hospital, you're not going to end up on a vent, and you're not going to die. And, so that's just some things to think about as far as vaccine. Because some of our parents are those ages, that are kind of resistant to taking the vaccine. And so I'm just, putting a plea out there to maybe reconsider, do some more research. Because sometimes the kids are getting sick at home. So that's where they're getting sick too. So we're just trying to hope that and we don't want to have to be in masks forever. We felt like if people masked until maybe like October 1st, till everybody gets back in school, the college gets back in school, hopefully our numbers are going to come down, and then we could remove masks, make a recommendation to remove masks. And we also want to look at this every 2 weeks, not just once a month or once every 2 or 3 months. We're looking at these numbers daily. We're talking to these people daily. We have an entire epi room, and I have, anywhere from 6 to 7 people. That's what they do from morning till night, is do the investigation and gather the information. And we hear their stories. We're able to figure out usually where they, how they were probably infected, where they were at when it most likely happened, because you start linking things together and you can figure it out. We're already seeing cases from the fair. So you were talking about people weren't necessarily masked at the fair, and it was outside. And kids at recess don't need to wear masks out at recess. They do need mask breaks. Everybody needs a mask break. But we are already seeing positive cases from the fair, and probably will for the next week or so. And you can link, it's not that hard to link things back when you start looking at people and at all the contacts. So, and we've had 2 young children, who unfortunately have become extremely ill. One child was transported from Via Christi last night, 6 years old, transported from Via Christi last night to Children's Mercy. They couldn't send her to Children's Mercy as soon as they needed to because there was no bed availability for her. So they had to wait until another child was discharged so that she would have a bed. So that does happen. It's real. So right now, I only know of 2 children who've become seriously ill. But we just are hoping that doesn't happen to other children. So have I answered you as the board questions? I did bring some articles. One of them is put out by the American Pediatric Association, and it is Mask Mythbusters, Common Questions About Kids and Face Masks. So I thought that might be something handy. Did I get that sent to you? I think so. But I did make a few copies in case anybody here tonight wanted that. It's a pretty good art. It's put out by healthychildren.org, and it's done by the American Pediatric Association. And you heard Dr. Humble speak and what she's seeing currently in her practice. And all of the local pediatricians did write a letter in June recommending face masks. But and some of the hospitals did as well. No one wants to hurt children. The biggest thing is just trying to stop the spread before, because right now we're a pretty big hotspot for it.
we'll reevaluate in October, right? I mean, that's what I
We'll
understood.
reevaluate
Because I
because-
know you're looking at it all the time, because we don't want, I know this is tough.
Yeah, and these are numbers coming straight, these are our local numbers. This isn't anything that I'm taking from national numbers or percentages or national trends. This is what's happening here in Crawford County. So we'd like to see things get better. And I think you agree. So, anyway.
Thank you.
Can I have a question, please?
Sure.
Okay, so about 3 years ago, we had over 100 kids sick at RVH with the flu. Why were we not concerned right before Christmas with the stomach bug? When kids are getting ready to go visit family, and I'm concerned more about the stomach flu whenever they're puking like crazy and they dehydrate. But nothing happened then. We still went to school, no mask. What happened then? Why is the county concerned? Why wasn't the county concerned?
Well, I wasn't in this position 3 years ago, so I can't really answer that question. However, as a nurse for 45 years, I've always been concerned about the flu. We lose a lot of people.
Yes.
And I think if we were more cautious during flu season, we wouldn't lose nearly as many. And that brings up another good point. Just like Dr. Humble said, we almost saw no flu.
Because it
Or
was
strep
the
throats.
COVID cases.
Pardon?
Because it was the COVID cases.
She said it because it was attributed to COVID cases. They're calling.
No,
All the
ma'am.
symptoms are the same.
When they test positive for COVID, that is not. And I think if Dr. Humble wants to speak to that testing,
What
that
about the
we do
PCR
PCR testing, which checks, which deals with the DNA of the virus.
Does the FDA approve that?
Yes, ma'am.
Does the FDA approve vaccines?
No, right now it's under emergency use authorization. It's going for FDA approval.
So why, I got an honest question for you, your health department. Why would I take a vaccine that's not approved by the FDA?
This is actually just an informational session that she was sharing. If we want to do something different, you can probably reach out to her another time.
It is, I mean, health department. Yeah.
Morning. I'm gonna speed through some things pretty quick. I know we've been here for a while, but I want to visit about this return to school guide, some of the things in there. And I'm just gonna reiterate this and make sure that we're all on the same page. But in the last year, our policy practice has been, we followed the recommendations of the county health department for our guide. We've made adjustments accordingly. That's been in play from the beginning, but I want to discuss a couple things that have come up. Remote learning. In that return to school guide, remote learning is not an option. And I want to make sure that you understand a little bit more about this. But House Bill 2134 was legislative action. It defined remote learning. Remote learning is when you provide instruction with a teacher and they're receiving the same type of instruction they would if they were in school, and you can deliver that in different ways. They put some restrictions on that. You may not provide more than 40 hours to any student. That wasn't our decision. That's from the legislature. Okay, that's a House bill. That's a lot different than it was last year. But you as a board, and if we have a large number of kids that are quarantined or can't be at school, we need to do something. And so the 40 hours, it is what it is, but if they exceed 40 hours, we need to exceed 40 hours. We need to provide. So you as a local board can exempt due to an illness, medical condition, injury, extraordinary circumstance. You have to approve that. That's different. We've never had to do that. So if a student is remote learning 40 hours or more, that's going to have to be a board-approved action. And not only that, then it has to turn around and be approved at the state board. don't like that, but that's the law of land right
So it
now.
has to go through two steps. It has to go through us, and then and then if the state says no, we're just,
Well, they won't.
They
But
won't,
it-
okay.
I say that. I guess they could.
well, they could, but they probably wouldn't if we
But
exempt
the whole thing looks a lot different than it did last year. And that's why, and I think in theory, the idea is to get kids back in school. And we want that. We also recognize there's gonna be kids out of school a lot this year too, because of the quarantine. Next thing I wanted to talk to you about real quick is a transportation mask order. This was just brought to our attention last week. This order's been in place, but I think the definition, we had a meeting with our state commissioner and also visited KSB on opinion on this, but the bottom line is this, and I'll just make this short and sweet. There was an executive order that went out from CDC and an executive order from the president that at the time, that if you're on public transportation, you have to have a face mask. I think the state did not consider at that time school buses or school vehicles to be public transportation, because not just anybody can get on. They're not just open for anybody to jump on. Well, they have redefined that, and that does include school buses, and I believe that runs till September 13th. So even if we were not in a face mask mandate of any kind, our transportation vehicles, and that also includes suburban vehicles hauling a golf team to a golf meet, right now, they need to have face masks on. That was just brought to our attention last week. So another thing I wanted to share with you real quick is I just kind of give you an update on where we are. I'm going to skip through some of these things, but I am going to show you, starting the school year off, what we know right now. And this first day of school, so we have kids coming in and coming out, some kids out of state. We don't have updates, or the county doesn't know some of this, but to start the school year off in our district right now is Girard High School. Let's go down here, current. Girard High School, we have 2 positive case students. We have 3 in quarantines. We have 5 out with quarantine or isolation. Girard Middle School, we don't have any positive cases, but we have 4 students quarantined. At RBH, we had 1 positive student and 12 in quarantine. So, make a long story short, on the very first day of school, this is the number of kids that are out of school with positive cases, or they're in quarantine. That's a little bit discouraging. Hope that changes quickly, but and that's what we know. There's still some that we may not know about. Like I said, they just showed up today for the first time, and some of these kids came from out of state. One of the buildings had one, I said, they're quarantined. County Health Department didn't know anything about the quarantine, and found out they came from out of another state with papers for quarantine. So it is what it is, but I wanted you to see where we're at just to start the year off.
What's the difference between the overall and the current?
The overall are the kids that have been in quarantine that are already out. We have some that, when I say, let me explain this to you too. Last year, we're tracking this just like we would a budget year, from July 1 to June 30th. So July 1, we started over. We still have the data from last year. So these are kids that have been in quarantine. If it's overall, they may have already been out of quarantine before school started in the last day or 2 or 3. But that's what we know. And I'm sure there's probably more than that we don't know about yet, because we haven't been around. But the current is right now. That's what's going on in the building right now. I'm going to stop there. Do you have any questions?
Agenda item 13, approval of 2021-2022 district classified handbook.
Attached to your board packet was a proposed classified staff handbook, and you should see the changes from the previous year in red. If you have any questions, we can discuss that. If not, I'd recommend that we approve that and just present it to you.
Motion to approve the 2021-2022 district classified handbook.
So moved.
Moved by Dave,
Second.
second by Peggy. All in favor, say aye.
Aye.
For the same sign. Motion carried. Agenda item 14, facilities and construction update.
And I'll go through this quickly too, but I do want to talk about asphalt. You know, we had a meeting a month ago and we said there's no way they're going to get this done in time, and they did. But this is the southwest parking lot that needed a lot of work. We just redid it. I'm just showing you pictures. You look towards the building, we did pour some cement area where the heavy bus traffic is. Let's just look at it. I want to explain this right here too, because I've had people tell me, new parking lot, got water standing there already. What's the deal there? What we did is we have drains in this parking lot. Is Troy still here?
Right here.
Yeah. You want to explain that?
This?
Yeah.
So as you all knew before, we had ponds out there after the rain. So part of the new installation included putting in a drainage system. So we have like 4 or 5 drains. Those all initially were designed to tie in together and carry that down to the west ditch down there that's right off the football field behind the visitor bleachers.
We were going to, let me interrupt you a second, we were going to rip this out and run this drain all the way down, what he's saying, all the way down here to that ditch, correct?
Correct.
The city, we approached them, go ahead.
Yeah, after approaching the city, once construction started, the other problem is right across the street there to the west. You all know that is like a pond as well, continues to hold water. So after approaching the city, they agreed to also put a drain at their corner. And so they're going to tie into our drainage system, run it through theirs, and then they're going to redo that ditch going west. So that way we didn't have to tear up our parking lot to run it to our side.
So right now, the drains are working, but the water has nowhere to go. So,
Correct.
and I know the city's waiting on
Their drain pipe, and it is on order. And
we appreciate them working with us on that, or committing to working with us on that. It kind of saved us some footage and tearing up some parking lots. I think it will be helpful for them as well. But we're going to ask approval of pay after approve that. This is the north side of the parking lot. Probably driven by and seen that. We liked how that turned out. They finished that first. Very, very pleased with the timeliness of getting this done. I was shocked that they finished this parking lot before school, quite frankly. You know, we kind of felt when we did it probably going to happen. We did do some upkeep on the visitors press box. If you look at that, the football facility looks nice, and the asphalt, which was needing to be addressed, has helped a lot as well. So I'll stop there just to save some time. I will quickly say our phase 4 HVAC is complete, right, Mr. Combs?
Yes, sir.
So, you know, we had a 5-year plan. We just finished the 4th year.
they're officially off the boiler system.
Yeah, everything is officially off the boiler system. And while we're talking about boilers, we did list that on Purple Wave along with some other things, and we'll have, I think August 31st is the ending date to get rid of the boilers. Okay, that's all I have.
Moving on to agenda item 15, approval of invoice pay application from Art Construction for the parking lot construction and payment.
So moved.
Moved by Roger. Second by Peggy. All in favor, say aye.
Aye.
Opposed, same sign. Motion carried. Next, executive session for discussion of meet and confer. Who's in here and how much time do you want? 10 minutes. And with administrators and school board members. We're going to take a 5-minute break, so we'll start back up at 8:29 and go for 10 minutes.